we found that we really needed to get into laser-focused change, little tiny increments of change that would make a significant difference in the outcome. So we developed everyday zeros for the critical care units, and we also developed heat teams to focus on hospital-acquired harm.
We call it the HEAT team because it's a harm event action team. It really is important to know what causes the falls. Is it a physiological fall? Was it a mechanical fall? Is it related to behavior? Some of those you can prevent, and those are the ones you really need to focus your efforts on.
We've been putting together metrics for many years. Our board has a dashboard that we share with management and physicians. So we are trying to get better like many organizations, and the real power comes when bringing that data to the front line. When I round, I like to look for data on the walls that the frontline staff can speak to.
Our physicians, by and large, want to be very helpful and very engaged in reducing harm. They like to see evidence, and they like to make certain that we practice evidence-based medicine. As long as that is conveyed to them and educated to them, we have good participation.
We are measuring data really closely, and we're trying to capture all the events, and we've encouraged, as a part of a culture of safety, for staff to report all events. And we've even encouraged the reporting of good catches.
The real power of data comes when it is in the hands of the frontline managers and employees. So we're really working to drive that data every day to the front line so they can speak to it and use it for improvement.
We have a medical staff quality committee. This is a multidisciplinary committee. This is a committee for the entire health system. We have representatives from every department at this committee looking at improving quality and patient safety.
The yellow socks are a way to help us identify quickly a patient that was on the move.
The yellow campaign is to really use yellow alerts, including yellow stockings, yellow wristbands, and yellow sliders on our door frames, so that staff are aware when they are working with this patient that they're very high risk for falls. After 2 years of the program being implemented, we've seen a reduction by about 1/3 of the fall events and about 1/3 in falls that resulted in harm.
Senior leadership was very involved in our celebrations. Herb Geary was actually at our staff meeting when we celebrated our collapse-free days last year.
We're really proud of the fact that when we get to a very high number and we have an event that brings us back to zero, we raise the bar higher. We celebrate the run that we had and then look into really in-depth what happened to the one new case that probably shouldn't have happened.
I think the biggest results have been overall engagement. You can walk onto the floor, see a patient in yellow socks to prevent harm, yellow armbands. You can talk to a frontline employee about what we're doing to prevent collapses, what new ideas they have. That's truly the change we wanted to initiate, frontline engagement every day.